One of the first weeks that I came, my daughter brought in her baby doll. And Dr. Weitzel wrote down her baby doll's name so that all his staff would know when Aurora brings in her baby doll, this is what the baby doll's name is. And so now all the nurses and the receptionists know my daughter's doll's name. So that's just a little example of the intentionality. We care about you as a person, we care about your family. Because when you're pregnant, when you're sick, you need to feel safe.
I think that there's a lot of patients that have come here for the first time, sometimes in 5 years, 10 years, 20 years, 40 years, that have never been to the dentist. It's one of the best feelings to go from someone that had never seen a dentist and now they're coming every 6 months and they look perfect. And that's really, really rewarding for me.
SouthEast has a mission to deliver quality and compassionate health care to all, regardless of economic status. Anyone who has a need for primary health, dental, or medical can come here for care. We serve 20,000 patients a year.
As I drive all over town, I see my patients. They speak different languages, they speak the same language, they look like me, they don't look like me, and I think that really does show the amount and the volume of people that we see here.
I have options. It's not like I have to come to SouthEast, I choose to come to SouthEast. So if you have insurance, or if you only have small insurance, and you're looking for a good place for health care, you certainly can get that at SouthEast.
We have more than 40 countries represented in our patient population here at SouthEast.
We can really facilitate navigating this very unique American healthcare system, from how to approach an office appointment to what to do with prescriptions, referrals, insurance company. All these things may be very either unfamiliar or just totally new. Having staff like Bishnu and Niang, who speaks Burmese, not only provides a language translation, but a cultural translation.
People work here because they want to be here. It really adds a culture of caring.
I think people are here for the right reasons. I think our providers and our staff here want to see improvement of lives. And for each patient, that's very unique. Some people want to know recommendations on a better vegan diet, all the way to, I want to stop injecting heroin and get off the streets. I mean, we see this span of patients that come through our doors on a daily basis.
What's really nice about a wellness circle is I can pull them out of the exam room into a group setting where I can provide individual counseling, I can provide group counseling, but I have an audience for about an hour or more where we can slow down, relax, talk to one another, and get to some of the items that are most important, not just to me, but particularly to them. They're the ones dealing with the diagnosis. What's important to you? What can I do to help you accomplish your goals, to have improved quality of life? We have over an hour to sit together.
What I find good about it is that I know I'm not the only one that's diabetic. So coming here, you find people that are in your same boat. Some may not have it controlled, some may, but in the end, you all have the same goal, to control your diabetes and to have a better life.
It's amazing to watch all of them grow. Oh, there she is sitting up.
She looks forward to seeing other babies, to see what they're doing compared to how our daughter is kind of.
How she'll interact with them, how they'll interact with her.
It's like baby interaction time.
Yeah.
All right, guys, you see this? This is a baby that's gonna crawl soon. I think one thing during the group visits is they get to know their provider even at a different level. So instead of a 10 to 15 minute office visit, we get an hour and a half of time with them. They can ask us questions that maybe they don't feel like we have time to ask at an office visit. Spending more time answering that question, we know in the room there are other people with that same question or thought on their mind.
Sometimes I don't know, okay, is she supposed to be doing that? Should she be doing that? And being able to engage with other parents and their babies gives me a better understanding and actually makes me feel calm.
The next visit when you're here, our dental hygienist may come and visit. because we're doing fluoride on all the kids' teeth as soon as they have the first tooth.
So how are you today? I can't tell you how great it is to work in an office where you have the physician of your patient right downstairs. If I have a patient and I have a medical question, I can a lot of times get a consult from that person's own physician. There's no place else that I'm going to find that wherever I go.
Community health centers are a wonderful way for people to get care as they need it, where they need it, when they need it, and how they need it. We have 3 different sites. You can get services in the Southeast, on South Duke Street, in the Northwest on North Arch Street, or in the Southwest on Hershey Avenue in the Brightside Opportunity Center. We've been in this community for 40 years. Our role in the community is to make sure that people can get health care that they need.
Who belongs at SouthEast? Anybody that wants good care. It's a wonderful thing to be a part of. There's lots of resources here. Resources like they're not going to find anywhere else.
I think everybody belongs here at SouthEast. If you want to come, the door's open. We're anxious to work with you and for you.
I think the idea that a patient sees their medical office, their healthcare office as a home, as a place they belong, I think has huge value. That sense of connection, that sense of stability and permanence.
Not a day goes by when somebody hasn't walked out of our doors having their life changed in a small way or in a huge way.